Welcome to my podcast, Dermatologist Talks Science of Beauty. I'm Dr. Teo Wan Lin, and in this week's Dermatology Flash Briefing, we're going to talk about the causes of enlarged pores. This is a complaint that I hear quite a lot in my practice. A little bit of my background. I am a dermatologist with my private practice in Singapore at TWL Specialist Skin and Laser Center. I see patients with both medical and cosmetic dermatological conditions. Enlarged pores is actually a colloquial or a layperson's term for increased prominence of the follicles on your face. What are the causes of this? I would state the following three as the top causes of enlarged pores. Firstly, acne-prone individuals tend to have oilier skin, and this means that their sebaceous glands or their oil glands are much more active. The sebaceous glands are connected to the hair follicles, and when there is increased activity of the sebaceous glands, it can overall cause increased prominence of the appearance of the follicles in the face as well. Blackheads, also known as open comedones, is a type of acne that can lead to the appearance of enlarged pores. Blackheads appear as little bumps on the face with an opening to the surface. This opening is often filled with oxidized skin debris, which is why it appears black. It consists of a mixture of oil, dead skin, and grime, other types of material that's collected in the skin's follicles over a period of time. The second commonest cause of enlarged pores is actually a condition which looks a lot like acne, but isn't acne at all. In fact, it has been mistaken for acne in a lot of patients. This condition is known as rosacea. Acne rosacea is a subtype of rosacea that looks very similar to acne vulgaris. However, there are a few distinct characteristics of rosacea which can help us differentiate between the two conditions. First of all, there is increased background redness, what we call erythema. This is associated with the blood vessels being highly reactive to temperature changes in the environment. An individual with rosacea will find that their skin is persistently flushed as opposed to an ordinary individual who simply has flushing after exertion in warm weather conditions. The facial flushing in ordinary individuals will resolve when the skin's temperature is cooled down. However, in individuals who suffer from rosacea, the skin remains persistently flushed. It is often mistaken for acne because there are pustules and papules in certain variants of rosacea. In fact, the flushing and the skin swelling can also look like sensitive skin or eczema. Most importantly, when you suffer from rosacea for a prolonged period, over many years, there is an increase in the blood flow to the skin surface, which can result in skin thickening. The end stage of rosacea is a condition known as rhinopima, which is disfiguring. The skin thickening that occurs in rosacea happens over many years, often over decades. Individuals with rosacea often complain that the skin texture is rough, irregular, and also complain of having enlarged pores. Another cause of enlarged pores is related to photoaging. Biological aging is a process that correlates with your chronological age. Photoaging and environmental-related aging, such as oxidative stress from ultraviolet exposure or from environmental pollutants, all these generate free radicals at the surface of the skin, and this results in oxidative stress. As a result, when skin ages, you may also find changes in the skin's texture. If you have pre-existing conditions like rosacea, acne, or have some form of scarring from these conditions from the time when you've had them, perhaps when you were younger, you'll find that as you grow older, these facial pores may become more prominent as a result of aging as well as scarring. Now that we've covered the commonest causes of enlarged pores, I'm going to give you some general skincare tips which can prevent and also hopefully treat some of your concerns. First of all, if you do have untreated acne or rosacea, it is important for you to visit an accredited dermatologist who likely will start you on prescription medications to get the condition under control. Skincare is an important part of the treatment of any dermatological condition. Specifically for addressing the case of enlarged pores and acne, I find that it's appropriate to incorporate home treatments such as microdermabrasion. Microdermabrasion used to be only practiced in the clinic or office setting by clinic personnel using diamond tips. These are fairly abrasive. With the advent of vacuum microdermabrasion, such as hydrofacials as well as the Korean-type medifacials, one realizes that the non-abrasive ways or methods of microdermabrasion can effectively increase the absorption of antioxidants at the same time resurfacing the skin. Enhancing cellular renewal is one way to minimize the appearance of pores. However, if you do suffer from rosacea, microdermabrasion is likely going to trigger off a flare-up. This is only applicable for individuals who do not have active acne, who have enlarged pores due to acne scarring or overproduction of sebum, hyperseborrhea, and also in individuals who have photoaging. The concept of vacuum microdermabrasion is best described as a form of microscopic skin exfoliation. Usually, dermatologists would recommend chemical peels such as acids with glycolic acid, salicylic acid, lactic acid in the chemical peel contents, which help to resurface the skin by enhancing cell renewal. This should only be performed by trained medical personnel and at concentrations which are effective and safe in the clinic setting. These should not be supplied to home users. However, using a home device such as a vacuum microdermabrasion device can offer a form of home-based facial peeling that is gentle, and ideally the vacuum should also be adjustable to different settings in order to cater for individuals who may have sensitive skin or slightly drier skin. Well, that's it for this week's Dermatology Flash Briefing. We've spoken about the top 3 causes of enlarged pores, as well as my favorite intervention for effective home treatment, which is vacuum microdermabrasion. I hope you've enjoyed today's podcast episode. You can follow me on my Instagram at Dr. Teo Wan Lin for the latest podcast updates, and also visit us on our website at www.scienceofbeauty.net.